Hi there wonderful people, as always today we have an interesting yet informative video about your baby. So in this video we are going to talk about broken bones. How can I tell if my baby has broken a bone? Making this determination on your own can be difficult, but chances are the bone's not broken, just sprained. Babies' bones are so pliable they rarely break. If your baby's injury only swells a little bit and he doesn't seem to be in much pain, it's alright to treat the injury with ice and wait a day or two before calling the doctor. If the swelling goes down and things seem to be on the mend, it was probably a sprain. But if the injury doesn't improve or gets worse, it's time to take your baby to the doctor for an exam. Of course, if you're really worried, or you don't know the extent of the injury, you should err on the side of caution and see the doctor. Here are some other warning signs of a broken bone: a snapping sound, bruising, tenderness to touch, severe pain, especially in one spot, increased pain with any movement. Don't assume that if your baby can move his limb or digit it's not broken. That's an old wives' tale. Stiffness, limping or the inability to stand or walk, for a child who can walk, refusing to stand or walk a limb that seems bent or out of position. What if I can see a bone protruding from my baby's skin? If your baby is in an accident that causes bone to pierce through his skin, call 911. If you also suspect a neck, back, or skull injury, or get him to an ER right away. This type of break is called an open fracture. Because of bleeding and the risk of infection, it is the most dangerous type of break. Don't touch it for any reason, even to wash it. To lower the risk of infection, drape the open wound with a clean cloth diaper or sterile gauze and either call 911 or proceed to the nearest emergency room immediately. What should I do if I think my baby has broken a bone? The best thing you can do is protect and immobilize the injured area, making sure your baby doesn't worsen the damage. Comfort your baby, and get medical attention right away. If you suspect a skull, neck, back, or pelvic fracture, don't move your baby. Call 911 immediately. In other cases, call your healthcare provider. If your baby has a non-life-threatening fracture, your doctor will likely tell you to bring him to the office or to the emergency room for an exam, and possibly x-rays, and give advice on how to move him safely. Don't give your baby anything to eat or drink, as it may cause a delay in medical treatment. If the bone needs to be reset or your baby requires surgery, doctors will have to wait to give him anesthesia until his stomach is empty. And never attempt to straighten or change the position of a dislocated joint or broken bone. You could make the injury worse. You'll also have to be on the lookout for symptoms of shock or internal bleeding. Call 911 or go to the nearest emergency room immediately if your baby has visible head, chest, or abdominal wounds, or if he has any of these symptoms: a weak, rapid, or irregular pulse, clammy or bluish skin, rapid, shallow breathing, confusion or loss of consciousness, coughing up or vomiting blood. How do I know if it's safe to move my baby? Unless you suspect a serious injury to the head, neck, or spine, it should be fine to move him. But if your child has a bad break, it's important to immobilize the injured bone or joint first. This will minimize any further injury and will make moving your baby easier. The method you use for protecting the injured area depends on where the injury is. What should I do if I can't get medical help right away? Over-the-counter children's pain remedies such as acetaminophen and ibuprofen can help ease the pain. Other than that, follow the ICES approach: ice, compression, elevation, support. Here's how. Ice decreases pain and swelling. If you don't have an ice pack, wrap some ice cubes in a dish towel or plastic bag and crush them with a hammer or by banging them on the kitchen counter. Or simply grab a bag of frozen veggies from the freezer and wrap it in a towel. Hold the ice pack against the injured area for at least 20 minutes, 4 times a day. Compression decreases swelling. After you've iced the injury, wrap an elastic or fabric bandage around the hurt limb. It should be snug but not tight. You should be able to stick one finger between the bandage and the skin. Check the tightness frequently. If the limb continues to swell, the bandage could become painful. Elevation decreases pain and swelling. If you can get your baby to lie still, place a pillow under the affected limb so that it's elevated approximately 6 inches above his heart. Support helps immobilize the limb and reduces pain. Put a splint on the affected limb. If you suspect a broken arm, rib, or collarbone, use a cloth or diaper sling to hold the arm in a bent position next to your baby's body. How do I immobilize a suspected broken bone if I can't get medical help right away? If your baby has a bad break, your best bet is to call 911. The paramedics will know the safest and most effective way to immobilize your baby's injury and move him to the hospital. But if 911 isn't an option, you're camping, for example, use whatever is on hand to create a simple splint. For example, you can use a ruler, paper towel roll, small firm pillow, rolled up coloring book, or any other straight, firm object. Make sure the splint is slightly longer than the bone and joint you're supporting. Wrap the supporting item with a diaper or soft cloth to protect the skin, then use handkerchiefs, belts, strips of cloth, shoelaces, bandanas, or ties to tie it in place, without moving the injured limb, at the joints above and below it. If your baby's lower leg is broken, for example, you'd tie the splint at his knee and ankle. For a fractured collarbone, place the arm on the injured side in a sling, and tie the sling around the shoulder on the opposite side. If you can move your baby without putting him in much pain, skip the splinting stage and just bring him into the emergency room or doctor's office. Immobilization is most important for severe injuries and when a trip to the ER could take hours. What specific advice can you give for a broken arm, wrist, or hand? Start with the ICES approach outlined above. Then, if the hand or upper arm is injured, make a sling to support the arm. Fold a large piece of cloth into the shape of a triangle. Gently slide the wide part of the triangle under the injured arm. Tie the two long loose ends around the neck. Make sure the sling is tied tight enough to hold the arm snugly. If a bone in the forearm or wrist is fractured, use a folded newspaper or magazine padded with a towel or small pillow to create a splint that immobilizes and protects the broken bone. Place the lower arm into the splint, supporting the injured area. Tie the splint around the arm using cloth strips on either side of the break. After securing the splint, make a sling to support the arm. What specific advice can you give for a broken finger? Raise the finger above the level of your baby's heart to help minimize swelling. Apply a cold compress for 10 to 15 minutes. Then splint the broken finger by placing a piece of cloth or cotton between the injured finger and an uninjured one and taping the two fingers together. What specific advice can you give for a broken leg? Follow the ICES approach described above, then, if the injury is below the knee, make a splint. Boards or sticks work best. If they aren't available, you can use a blanket. Place one board on the outside of the leg, extending from hip to heel. Place the other on the inside, extending from groin to heel. Pad the boards with blankets or pillows to protect the leg. Then tie the boards in place at the groin, thigh, knee, and ankle using cloth strips. For a blanket splint, roll up the blanket and place it between your baby's legs. Then tie the legs together at the groin, thigh, knee, and ankle. If the injury is to the upper leg or hip, don't move your child unless absolutely necessary. Call 911 for help. If you must move your baby, make a splint with boards. One board should extend from your child's armpit to his heel. The other should reach from groin to heel. Pad the insides of the boards with towels or pillows, and tie them in place with cloth strips at your child's chest, waist, groin, thigh, knee, and ankle. That's all what we have for now. If you have had a fracture when you're young, share that story with us in the comments. Like this video if you have gained some knowledge from here. Make sure you've subscribed to our channel. See you all later in another video. Bye for now.